Good morning or good afternoon, everybody. My name is Liz Lloyd. I am the Chief Impact Officer of CDC, and we are delighted to welcome you to our webinar on labour and occupational health and safety aspects when returning to work. We're welcoming Ergon and RSK, who are specialists in labour, human rights and occupational health and safety respectively, who will introduce two new CDC-sponsored guidance notes, which are the subject of this webinar. We are doing this in order to offer assistance to employers on how to anticipate and manage labour-related issues when operations are resuming, in part or in full time after lockdowns, particularly where a return to pre-COVID-19 work locations is involved. In general, CDC's response to the COVID pandemic has been in three areas: preserve, strengthen, and rebuild. Preserve, where we're supporting our partners to safeguard impact and weather the crisis. Strengthen, where we're scaling up our response to the economic and health challenges of the crisis. So providing liquidity or working capital to businesses as they need them, or exploring investments that can scale up access to healthcare and basic services. And then over the longer term, looking at our role in rebuilding and being a partner to the countries where we invest. We know that this pandemic will take many months to play out, and the effects will be felt for a long time. We know that institutions like CDC will be critical to the rebuilding process. These guidance notes are relevant to pretty much all three of those pillars, supporting our partners now to safeguard impact as they employ over 800,000 people in South Asia and Africa. And also as we scale up our response to the pandemic and look towards the future. This has been a great collaboration across our internal groups with our investment teams and with our partners, Ergon and RSK in this. So let me hand over to Guy, who's going to shepherd us through this webinar. And we really hope that you contribute, ask your questions, make comments in the chat in the functions so that we can have this as a really engaging process. So thank you all very much. And I'll hand over to Guy.
Thank you very much indeed, Liz. That was a very welcome introduction. And well, can I just extend my own welcome to everyone to this webinar. My name is Guy Alexander. Some of you on the call will probably know me already, and I sit in CDC's Environmental Social Governance Impact Group. I just wanted to say, by way of setting this up, that the last 4 months have been something of a roller coaster for every single person on this call and in CDC's portfolio. And we're still far from normal, even in the UK at the moment. CDC is still not working from an office environment, and I right now am working from home. Return for work, though, is a reality for many, and it comes with its own set of challenges. These could be in relation to introducing a new set of risk controls in order to minimise the risk of transmission of COVID-19 in the workplace. These could be considering how to get more workers safely into work. These could be related to morale and the stresses of reintegrating workers after a period of absence. Or it could be about communication and making sure that employees have the right information to operate effectively. What CDC, the Impact Group, have done is we produced two separate guidance notes, and whilst they interlink, they've been prepared by specialists in their respective fields. In a minute, we're going to turn the floor over to Ergon, who some of you will have heard speaking about job protection and what investors can do in order to sort of minimise and advise their portfolio better. That will be first up. And then after that, we'll hear from Paul Reynolds and the RSK team, who will be talking about occupational health and safety and how to conduct risk assessments and make decisions aimed at keeping workforce healthy and safe. Following that, we're going to try and allow as much time as possible for a question and answer session. And as ever, the role I want to play there is to try and make that question and answer session as practical as possible. So I really do encourage people to use the chat to ask questions about how we can give advice that will be relevant to them in whatever line of work they are taking. Finally, I just wanted to make a few observations on housekeeping. Firstly, this session is being recorded and the recording will be shared afterwards. as well as we'll try and answer some of the additional questions that we don't have time to answer today at that later stage. My colleague Nick Stone is going to be in the chat and will be able to sort of respond to questions as they come up live if you want to sort of ask those questions in a more private function. And then we'll do our best to respond even more firmly after the webinar as well. Finally, we will circulate after this webinar a post-workshop feedback form. We'd ask everyone to complete that in order to evaluate the event and make sure we're sort of scratching the itch, if you like, of what people want to hear about today. So, first up, we're going to turn the floor over to the Ergon team, and it's going to be Kirsten Newitt opening up for Ergon with her colleague Mac Doigneau, and this is going to be on the labour and workforce considerations of return to work. So, thank you, and over to the Ergon team.
Thanks very much to both Liz and to Guy, and thank you also to CDC for the invitation to speak today. Mac and I are delighted to be talking to you about the guidance that we have worked on with CDC on returning to the workplace during COVID-19 with a focus on labour and workforce considerations. So for those of you who don't know us, Ergon is a specialist consultancy that advises a number of leading DFIs on labour, human rights and gender issues. And in recent times, we've very much continued this work throughout the COVID-19 outbreak and have developed a range of materials on labour and COVID-19 for CDC, but for others as well, including EBRD and IFC. So in terms of the session today, I'm going to start with a brief overview of the content and structure of the guidance, and then Mac and I are going to spend about 20 minutes giving a summary of its key elements before handing over to Paul to talk about the OHS specifics. So broadly speaking, the guidance aims to provide support for employers to think through the labour issues that are likely to arise during the process of returning to work after lockdowns are eased, and then giving some pointers on how to respond to these issues. So, CDC identified a need for this guidance, given that, with many companies having already pivoted their business operations substantially to deal with lockdowns, they're now facing a whole new set of challenges and uncertainties as lockdowns are gradually eased. So I think for all of us, we're very aware that that reopening workplaces is not about a return to pre-COVID business as usual, but it's rather about how to transition to a new way of doing business. And how to face these challenges that have not been encountered previously. On the one hand, it's about ensuring that workers and others are safe in reopened workplaces, but on the other, it's also about responding to new economic conditions and ongoing uncertainty about how the COVID-19 outbreak will continue to unfold. So the guidance is divided into two main parts. The first part sets out a range of considerations for all employers across all sectors to take into account. This is framed at the outset by a decision tree, which provides, which aims to provide a more systematic approach to thinking through the return to work. So providing a step-by-step overview of different decision points and considerations at each point for employers. And then the second part of the guidance is more sectorally focused. We know that the details of the challenges are likely to differ quite substantially across sectors. So that second part provides a deeper dive into some of those challenges. So for instance, it's going to look very different for in construction, for instance, recalling workers on construction sites where there are multiple subcontracting chains, compared to, say, FIs, where many workers might continue to work remotely. So on this slide, we have set out what we think some of the considerations are that apply across all sectors. So the return to work will present distinct challenges that will differ according to location, sector and workforce size, but we think that these are some of the really sort of key considerations. So First and foremost, I don't think it will surprise anyone for me to say that safety is really the first priority. So adopting the right measures to prevent contagion in the workplace based on a thorough risk assessment. So Paul is going to speak to the OHS specific shortly, but what we would just draw attention to is the fact that some of the measures that employers will need to take to ensure the safety of workers and others are likely to have knock-on effects for worker management as well. So, for instance, some employers might choose to introduce staggered shift starting times to minimise transition risks. This might have implications for working hours as a whole, which then might have implications for employment contracts. So it's worth sort of thinking through all of those consequences. As a second point, it's really important that employers have a strong handle on the relevant policy and legal frameworks. And there are two main elements here. So the first is understanding exactly how lockdowns are being eased and what kind of government guidance or regulation is accompanying the easing. You know, what's the status of any kind of relief schemes, such as tax exemptions for companies or income support programs for workers. So very much keeping an eye on that sort of changing landscape. But at the same time, it also means understanding how existing pre-COVID employment and OHS laws are applied in a COVID context. So for instance, this might mean looking at legal requirements for employee consent for unpaid leave, or it might mean that there are procedural requirements on modifications to employment contracts. It's also important to keep in mind that some jurisdictions have implemented COVID-19 specific legislation, for instance, around dismissals. Throughout the return to work, ongoing communication and dialogue with the workforce is really crucial. So communicating at each stage, the plans for the return to work, what kind of changes workers can expect, the rationale for the changes, the likely duration of changes, when and how they might be reviewed, and also importantly, providing opportunities for workers to voice questions and concerns. So communication with the workforce should be taken quite seriously in the context of return to work and also be understood as an ongoing process, not a one-off, as an important measure to sustain trust and confidence. And finally, across all stages of the decision-making process, a successful return to work will require the close involvement of the HR function. So HR teams will be really crucial for updating and adapting policies as needed in light of changing circumstances, communicating changes with workers, addressing any worker welfare or morale issues as they arise, keeping senior management updated on any issues, and also keeping abreast of any sort of relevant legal developments. So in this context, ensuring that HR has the capacity and the support that they need is really important, including the support and the engagement of senior management. And on that note, I'm just going to pass over to Mac, who's going to talk to you on the next slide.
Great, thanks, Kirsten, and thanks, Yanu, for manning the slides. So as you can see from this, I think somewhat crowded diagram is sort of the framework that Kirsten alluded to, and it is a simplified framework. I think there's a little bit more detail in the guidance, so please do refer to the guidance if you want a little more information and detail. But in essence, what we're looking at are the steps that companies can think about when planning a return to work, or maybe when you're sort of in an earlier phase of returning to work. And so as Kirsten said, I mean, I think the basic starting point is really understanding the nature of government sort of laws, policies that dictate how restrictions are being lifted. And that in turn obviously dictates what's possible in terms of returning to work safely. So sort of in the tree, you see, if circumstances don't allow for a return to the physical workplace, we have to think about whether we can continue working remotely Obviously not possible for all businesses or all sectors. So this might involve additional considerations about, what kind of ongoing support can we give to the workforce, depending on whether there's sort of a full sort of partial or no salaries being provided to workers. And I think, there is more detail in another guidance we produced for CDC on job protection, but those are things like, can we provide livelihood support? What sort of reassurance can we give through communications, outreach, philanthropic type initiatives, et cetera. But that is sort of covered elsewhere. Sort of the key or the meat of the guidance is really about, we can return to the physical workplace. That's possible. What do we need to do? And obviously begins with a workplace risk assessment, because as Kirsten said, safety is first. That'll be discussed by Paul. And then our guidance thinks about, how do measures that ensure safe work impact employment terms and conditions, and how does the HR function adapt? How do you adapt HR policies and procedures? So, to pick up on Kirsten's example, what if you're reducing hours or shifts to promote social distancing? What if you're changing services that you normally provide, like accommodation or transport or canteen facilities? This might lead to reduction in wages. This might really require consent under national law. We'd expect sort of consent to be required under most national laws for these types of modifications. So, this is also sort of an opportunity to consider whether HR policies and procedures need to be revised, for example, in relation to grievance or discipline or sort of sick or care leave or data and privacy, which I'll discuss in a moment. But all these things, I think, taken together shouldn't necessarily distract us from another objective, which might be looking beyond risk management or crisis management. And that's sort of referred to in that sort of bottom right box, which is about, are there opportunities to adapt or sort of transform the business in a positive way? Which again is something we can discuss later, but it's important to sort of pick up, I think, on sort of the forward-looking and possibly slightly more positive aspects of the crisis. But in essence, that's sort of the brief summary of the framework, which I haven't gone into too much detail, just because it is in the guidance in more detail. And again, as Kirsten said, the steps are sort of meant to be a bit generic, and it's supplemented in the guidance with sort of sector-specific tables. I think worthwhile to point out at this stage also is that a lot of the measures which are described in that guidance and in that decision tree really can be done at sort of no cost or low cost. So should be relevant to a lot of businesses like SMEs, which I'll sort of discuss on the next slide briefly, which sort of goes over some of the important overarching considerations which we discuss in the guidance. And picking up on what Kirsten said, it's about engagement and communication being a key sort of aspect, which obviously entails, I think, two-way communication, right? So it's not just about, ensuring that workers receive information, but also ensuring that workers' voices are heard. And there are obvious areas where we'll need communication. So, explaining new policies and procedures, explaining, changes to the workplace or new safety measures. And as I said earlier, for example, if some of these measures require reduced hours or maybe even reduced pay, communication and consultation is key, because you might need consent under national law for these types of measures. In terms of the sort of pragmatic aspects of the how, I think this is an opportunity to make use of technology. Lots of companies will already be using things like apps or sort of WhatsApp groups or worker surveys. Others where that's not possible, there's obviously scope for sort of socially distanced worker forums, those types of things. And also, I think, sort of related to that is we should remember that, constant communication can be an important aspect of sort of, ongoing trust building and communication, especially when, lots of workers might be under stress, or, there are mental health implications, obviously, of COVID-19. Which brings us sort of to the vulnerable workers aspect of it, and that box on the bottom right. you know, in the case of COVID, we're thinking about economically vulnerable workers, but also obviously workers that are sort of have health vulnerabilities. So older workers, workers with disabilities, workers with pre-existing health conditions, you know, all these workers need to be identified, and we have to sort of discuss what extra considerations or support might be needed. On top of that, you know, there might be workers who have caring responsibilities. Tends to be women in many geographies. And also, you know, in terms of gender considerations, women might sort of be more susceptible to discrimination or economic shocks. So we have to be aware of that. So I think fundamentally, this is just directing companies and employers to think about this when planning and sort of think about, you know, special communication or consultation or active measures where possible. That leads us to thinking about, you know, how do we train and support management staff? Obviously, managers need an understanding of any new HR policies and procedures so they can be communicated and applied. You know, that may require some form of training or induction. I think managers also need to be aware of the things I've just mentioned about sort of mental health or vulnerable workers, or the importance of communication generally. And then there's sort of a final point there, I think, about, you know, given that C19 moves at such a quick pace in terms of developments and information and government policies, I think, you know, companies need to always be monitoring and reviewing, you know, approaches quite consistently. I think, you know, that's obviously true of safety measures, but also true of the HR policies and procedures, which I'll discuss on the next slide, if you could. Great. So in terms of the sort of the HR topics that companies might want to think about or sort of develop, revise, or adapt in the context of recommencing work, I mean, I think we've set out 5 of them that I think are quite crucial, and some companies have started thinking about this. Some are still getting up to speed, but I think a crucial one will be sort of data protection and confidentiality, right at the top there. Obviously, a key concern when sort of companies are gathering health information to perform risk assessments or to understand worker vulnerability. If you're doing any sort of testing or collecting any sort of health information, I think a clear policy is needed at a bare minimum. And that policy should obviously, you know, set out what information is being collected, possibly in line with national law, where there's sort of national privacy or legislation or health legislation. You know, specify the use of personal information, specify who can access information, and the ways in which information will be stored and secured. So I think the data piece is something companies really need to think about, as well as grievances, which you have in that next little circle. I think many companies will likely have, you know, some sort of grievance mechanism already in place, but I think it's probably fair to say that C19 does raise new dimensions or questions. I think, you know, the disruption that's caused by C19 can lead to sort of different workforce complaints or even more complaints. For example, workers might have complaints that their work is unsafe. I think there might be sort of general tensions in the workforce because of changes to company operations. I think this is just generally a time to think about, you know, are grievance mechanisms accessible, including to people, you know, who are working remotely for many companies. And again, I think there's scope to sort of explore technology solutions, ensure workers are aware, you know, sensitizing and training managers, reminding people. So grievance, another sort of key HR consideration, as well as leave, which Kirsten will address.
Okay, thanks, Mac. So the COVID-19 outbreak means that companies really need to scrutinise their workplace policies on sick leave and caring leave. This may be a process that has already taken place prior to the return to work, but if not, it's worth taking another look. Partly because, you know, a very important element in minimising workplace transmission risk is that workers who are infected or experiencing symptoms do not present at the workplace. So eligibility for adequate sick pay plays an important role in this. So at a minimum, companies need to be up to date with applicable statutory requirements on paid sick leave and paid care leave as they apply to workers with COVID-19 or with caring responsibilities. They should also look at provisions in collective agreements and practice among sector peers. Where national law doesn't provide for sick or care leave, it might be possible to introduce forms of sick leave or care leave through the development of new policies. Companies might also be able to provide other forms of support, such as extending health insurance coverage. It's worth taking a look at the options. Disciplinary processes is something that perhaps not all companies have thought about. In some cases, companies might be looking to introduce new disciplinary measures to correspond to new safety protocols. For instance, in situations where there might be an ongoing failure to respect basic social distancing or to use PPE. It's crucial to ensure that if there are any new safety policies with accompanying disciplinary sort of consequences, that these are adequately communicated to the workforce so that everyone understands that they are there, what they are, what the rationale for the new rules is. And also a period of adjustment might be necessary for workers to become used to the new working arrangements. It's worth bearing in mind that there could also be sort of national laws in place, such as the right to refuse unsafe work, that might have a bearing on what kind of disciplinary responses are permissible. And then finally, processes for recalling workers. So in some cases, perhaps only a partial return to work will be practical as a result of OHS measures or due to reduced labour requirements. In these situations, companies should develop a clear plan for selecting workers that complies with national law. It should be based on consultation with the workforce to the extent that that's possible during lockdown. It should be aligned with non-discrimination principles, and it should involve access to a grievance mechanism as well. Next slide, please. Okay, so beyond the immediate implications of the return to work, employers will also be looking ahead to the next 6 months and beyond. I think it's fair to say that to some degree, uncertainty is going to become a constant over this time, and employers are just going to need to be prepared for the unexpected. This includes sort of possible changes to the business environment over time, but also potential subsequent waves of infections that might lead to worker absences or further lockdowns. To the extent possible, business resilience will be bolstered by preparing for change before it happens. So, and this is true of workforce management as well as other areas of business operations. So in terms of workforce management, it might preparing emergency communication strategies, HR and safety procedures that can be deployed in the event of further lockdowns, or considering setting out recall criteria for workers. By planning early, employers can give themselves a little bit more space. Looking ahead, there are potentially also opportunities to build on lessons learned as a result of the crisis. For many employers, this might be the adoption of more flexible working practices where it has been possible to continue work off-site. Or for many, it might be looking at how the use of technology can be further enhanced to strengthen worker communication and engagement. You know, generally thinking, are there old habits that can be left behind? Are there further changes that need to be made to fully capitalise on any new practices? There might also be opportunities to introduce new changes based on a longer term perspective. So linking business and employment priorities in a way that might also help companies to position themselves as an employer of choice in the new normal. So this could involve taking a more strategic and longer term approach to workforce upskilling and recruitment. So forecasting skills that will be needed to respond to different scenarios in the future that may or may not arise. You know, training workers to work more flexibly across a different range of areas. So this could involve offering workers greater training opportunities, but also maintaining employment security in order to realise returns on investment in skills development. And just to finish, I think by taking this kind of forward-looking approach, companies can help to build more business resilience in terms of their workforce management model in a time of uncertainty, and make sure that they're better equipped to deal with change as it arises. Guy.
Thank you very much indeed, Kirsten. As ever, both you and Mac, that was very insightful. We'll come back to some questions for the Ergon team after we've heard from RSK and Paul in a second. I just wanted to let those who've been talking in the chat about will we receive the slides and what will be shared afterwards. We will share the slides as well as some additional responses to the Q&A in the course of this week. So don't worry, you will get everything. And for the nuance in some of this, I really do encourage people to look at the guidance notes in more detail, and obviously talk to the CDC teams or your contacts at CDC if you want further explanation. I'm now going to hand the floor over to Paul and the RSK team to take us through the health and safety considerations of return to work. And as Ergon said, health inevitably comes first, and so this is very much a prominent concern of many businesses as the return to work happens. Over to you, Paul.
Thanks, Guy. Good morning, everybody. My name is Paul Reynolds. I'm Principal Audit and Compliance Consultant with RSK. And we work across a very wide range of areas in the business, and I cover the environmental side, health and safety. So it's been a real interesting time over the last few months, certainly with the subject and with COVID-19. I've recently been working abroad in the Far East, managing a team out there in the oil and gas sector, and had real first-hand experience of operating out there, managing people, and also being affected by the COVID-19 problems during the project. So real first-hand experience in terms of the subject itself, and learned a great deal during that period. So please ask any questions following the presentation, which Guy will manage. First of all, I'd like to thank CDC for the opportunity to be involved in the COVID-19 guidance document. The guidance document itself covers a number of areas from a health and safety perspective, including obviously the return to work and the changing workplace, and the issues companies and organisations will have in dealing with that. Also the likes of security arrangements, personal protective equipment, which we've all seen over the last couple of months has been a key part of protecting people against the disease. Obviously compliance with statutory, with regulations, and also the likes of implementing controls in the workplace, identifying what can be done sensibly, low cost even. We can implement controls quite easily if we think about what we're doing when we carry out our risk assessments. And then also in the guidance document, we've been similar to Ergon's guidance in terms of sector specific issues and considerations there. So it's been a really good exercise working with CDC and Ergon. So if we could move to the next slide, please. So just some background about the disease. and it's a novel virus which we've heard of, and we've heard from people on the news and different programs during the last couple of months. So just to bring us back to the start, it was discovered in Wuhan City, China, and it rapidly spread across the world, affecting every one of us. So these slides are really to give us some guidance on what we can do without masses of resource. We can do it, as I said earlier, pretty simply, cost effectively, which will give us an opportunity to implement controls across our workforce, across our working environments. So just the 3 points on this slide I'd like to cover really in terms of the problems that we've been having in our workplaces. And also I'd like to really emphasize the point that, it's important to avoid the spread of COVID-19 via workplace interactions. We need to make sure that we can manage our workplaces sensibly with the right controls in place, and we don't spread the virus when we're returning to work back in our workplace, which is going to look very different in the future. So the first point really is for the likes of cleaning and hygiene, making sure that surfaces are clean, and objects. We all use a whole range of different equipment in our working lives in the workplace. The likes of telephones, computers, laptops. Simple controls can be put in place to ensure that we're not spreading the virus using that equipment, and that's simply with disinfectant wipes or hand wipes or sanitizers while we're in the workplace. Very low cost, very effective, and can be put in place very quickly. So it as I said, it doesn't take a lot of expense to ensure we protect our people when we're back in the work environment. Why is it important to make sure our places are clean? Because contaminations on surfaces touched by employees and customers is one of the main ways that COVID-19 spreads. So when you think about the use of equipment and how we use it, you can imagine the ways of spreading it around the workforce very quickly if it's not identified and it's not controlled. The second point: promote regular and thorough hand washing by employees, contractors, and customers. And again, simple steps can be put in place to ensure that happens. I think the secret with any of this is to make sure that the likes of hand sanitizers and other cleansing types of equipment are available, because if they're not, then obviously people will not use that equipment, and again put the workplace at risk through spreading the virus. So hand sanitizers in prominent places, display posters promoting hand washing. We all need to do that. We all need to adhere to what controls are going to be implemented, and we all need to be diligent when we're in our work environment. And also the likes of combining communications with briefings from occupational health and safety officers. So there's a lot of information out there. There's a lot of guidance which we can tap into to ensure that we've got the right information at the right time. And you will have seen the news and the information coming through from governments in terms of applying controls and restrictions, easing of lockdowns, it's changing on a daily basis. So it's important to ensure that we keep up to date with that kind of information, so we can continue to protect employees, contractors, visitors during our time as we return back into the workplace. Promoting good respiratory hygiene in the workplace is a very important part of the presentation. It's a key area in terms of making sure we don't spread the virus. And again, you will have seen the simple protective measures that can be put in place very quickly and effectively. So the likes of face masks to be made available in the workplace. They're not expensive, and they are very effective. Well, they are effective in terms of ensuring we don't spread the virus through sneezing or coughing. So that's a key area in terms of the likes of PPE. There's also, obviously, I'm talking of PPE, but there are engineering controls that can be put in place also in the workplace. And that's where we would be looking at changing the workplace setup or the work environment, the likes of the desks, equipment, distancing for people in the workplace. So good respiratory hygiene in the workplace is key, and we need to make sure that we have that in place when we do return to work, or if we operate from work and from the home at different times. Next slide, please. So this slide moves us into risk assessment, and risk assessment is a process of identifying hazards, looking at who may be harmed and how, and then evaluating the risks. So that can be done in a variety of ways. It can be done simply just by a mental calculation of identifying what the risk levels are, or it can be done on a more complicated basis, as in a risk matrix. So risk assessment differs depending on the likes of the complications in the workforce, or the type of work environment. So it can be done simply, quickly, or it can be more complex depending on what the work environment is. But it's very effective in terms of identifying what the hazards are and putting control measures in place. So the key steps there, which are recognised, are identifying the hazards, look at who could be harmed and how, and again that lists a few areas there in terms of disabled workers, visitors, pregnant workers, children, and members of the public. Evaluating the risks, as I've said, can be a simple process of looking at those areas and then coming up with a risk factor. And also recording and reviewing the assessment. Again, it's important to keep that risk assessment up to date. People who carry out the risk assessment have got some familiarity about the work environment, the hazards, what to look for, so they can take a reasonable they can do a reasonable job in terms of identifying what needs to be looked at, and again recommending simple control measures for the workplace. So the risk assessment is important in terms of making sure we identify the hazards and put controls in place. It will need to be reviewed because, as we've said earlier, and Ergon have mentioned in their presentation, the workplace will continue to change as time goes on, where we need to adapt, and we need to make sure that the control measures are suitable and sufficient for the risks that have been identified. Next slide, thank you. So some challenges for small and medium enterprises, some key issues which face them. I've had first-hand experience, as I said earlier, of being involved with teams of workers who have been affected by COVID-19, and the requirements following that, or the health and safety implications from that, have caused issues. They've caused problems because of cost, not recognising the difficulties of sometimes applying workplace controls when you're in the likes of an oil refinery or out in the field, and you've got groups of people working together. So it's been a real challenge for some smaller organisations in terms of making sure that they've got control measures in place. But as you can see on the slide, some key issues which face them. Obviously, managing cash flow when there has been a reduction in sales. Obviously, there are major restrictions at the moment for carrying out certain types of work, and that obviously affects cash flow, which then the knock-on effect of that is either the work is stopped, or there isn't a lot of flexibility in terms of purchasing lots of PPE, as an example. So it's important that these issues now moving forward are taken into account. Understanding the duties as employers, what occupational health and safety measures need to be implemented. I've talked about a number of control measures, as in workplace controls, but it's really understanding what needs to be in place, what employers need to do initially, and then what they need to do managing these issues moving forward. So it's as I say, it's understanding what the duties are and making sure that they can apply reasonable and sensible measures to protect their employees. And managing the costs of implementing the control measures. There are more complicated control measures, more expensive, more challenging control measures which will need to be put into the workplace, the likes of segregation, or even altering physically the work environment. Certainly, the office where I work from is not suitable for 2-metre distance segregation, so there is quite considerable works needed for that environment. So again, it's managing the costs around those changes and making sure as we carry on, we can make sure that we understand what changes will need to be made and what costs are associated with those changes. How can they manage the impact? Well, the risk assessment is a cornerstone of health and safety management. So I mentioned earlier that can be done pretty quickly and effectively. And making sure that if employees are working from home, then a risk assessment still needs to be carried out to make sure that any employee working from home can keep themselves safe. And by doing that, they've recognised that the hazards have been identified and control measures have been put in place. Keeping up to date with government guidance and medical advice, and strictly adhering to social distancing guidelines. And as I've mentioned before, applying simple controls, good communication across the workforce and employees, and obviously providing low-cost protective measures, as in face scarves and gloves, etc. Next slide, please. So moving to pre and post C19, looking at pre-C19, working from home was the exception and not the norm. So like myself, I would work from home the odd day in the month, and in the main be in the office environment with everybody else. We know from where we've been and where we've come from, there's going to be significant differences there. So working from home is going to be the norm, and we need to make sure that our work office or our environment at home is suitable to do that. But again, working from home, unrestricted movement, when we had lots of people in the workplace, we had close working, certainly not 2 meters apart. We had interviews, there was interviews going on, discussions, poor awareness of potential risks from the spread of germs and disease. From my experience, the operational risk assessment really really focused on the nuts and bolts and the physical aspect of doing a task. The likes of disease and germs was really not looked at in any great detail during that risk assessment process. And going forward, we think we'll need to change, we'll need to adapt, and we'll need to think about what we do with our personal hygiene and what equipment we've got in the workplace to make sure we can keep up that personal hygiene. Post-19, there will be lots of changes. So there needs to be, as we mentioned, a shift in mindset and resource to enable new working realities and maintaining good health and safety across the workforce. Ergon mentioned it earlier in their presentation that work-ready homes or working from home will become easier. I'm sure we've all experienced problems with the internet and in the past when we've worked from home. It will become better and working from home will improve. And the likes of home video studios will become more equipped and become a safer place to work. The work environment itself, where working from home is not feasible, and we know the likes of manufacturing, food processing, people have to be there. They have to work on lines, they have to be close together, or they have been close together during those types of activities. But we still need to assess we still need to identify the hazards and assess the risk. So the risk assessment is key in those environments, and the control measures and review is also a key part of that process going forward. Next slide, please. This slide really brings us to some of the high-risk industries, one of them being the food industry. And the environment itself causes quite significant problems just by nature of how it operates. So the following are the known hazards in the likes of food industries, meat processing industries, the likes of slaughterhouses being ideal breeding grounds for COVID-19, cold and dry temperatures around about 6 to 10 degrees, combined with poor ventilation and air circulation. So there are other areas which these issues take us to with COVID-19. So the likes of cold and dry temperatures, ventilation. Ventilation takes us into good maintenance of that equipment and making sure filters are cleaned and maintained. So if there is any airborne dusts or there's anything which could create environmental contamination or airborne contamination is captured. difficulties keeping workers 2 meters apart during fast-moving production lines. There is going to be a lot of effort in terms of identifying what can be done simply and quickly to ensure that we can keep that distance and we can still produce. So there is a lot of work around the risk assessment process and also identifying suitable control measures to ensure that these areas, these industries can function moving forward. So the food industry, the likes of construction, as Ergon mentioned earlier, construction involves lots of groups of people doing many different tasks, lots of physical work, lots of interaction. There will be, again, risk assessment applied, which should, in theory, reduce risks if carried out in the right way. Agriculture is another area which has its own issues in terms of farming and the likes of applying the likes of biohazard controls. So it's important that each sector is looked at in its own right, because obviously the hazards are different when you look across all the industries that we've looked at in the guidance note. Next slide, please. This slide really was linked with moving forward and beyond COVID-19, and really looking at how organisations are going to continue to keep themselves safe, keep their employees safe, contractors, visitors, anybody who is connected with the business and its activities. And this slide just gives a kind of a three-phase model, really, in terms of looking at resilience and what we've done during this pandemic, and making sure that we can maintain our standards. Recovery coming out of the lockdowns, and looking at how we move forward safely, applying the right controls, making sure that we can bring people back to work safely, we can monitor and we can maintain the controls that we've put in place, which, as I said earlier, will change as time goes on. And also, when we do move into the next couple of months with the easing of lockdowns, then there will be, I think Ergon mentioned this earlier, the likes of policies, procedures, other working documents will need to be reviewed. They'll need to be amended in light of COVID-19, and what we may have is a new range of documents, from policy right the way down through to operational procedures. We'll have new workplaces which have been changed, they've been altered in light of the controls that we need to put in place. So there is a range of steps which are, if we focus in on identifying the hazards, evaluating the risks, and putting them control measures in place, and then renewing and reviewing that process, will hopefully keep us in a good position with what we do in different organisations, different sectors, how we do things, and what we're gonna do in the future. Thank you. I think that's all the slides taken care of.
Thank you very much for that, Paul. And I particularly appreciated how both you and the Ergon team sort of move from risk and sort of starting to think about what the opportunity is for future workplaces of the future, whether that's in 6 months' time or in 12 months' time. I think what I'm going to do is, I'm just listening to both of you talk and looking at some of the questions come in. I'm going to sort of start a bit of a discussion going, and sort of focusing on about four or so buckets. The first of which being vulnerability, but I think that we'll probably also take the time to sort of do a bit of a deeper dive into some of the OHS questions that I'm recognising coming in on the chat screen coming in, as well as also thinking about how we do balance risk and opportunity and what future forms of employment might look like. But just coming back to this concept of vulnerability, which obviously underpins both OHS and workforce from a sort of a risk assessment point of view. I mean, maybe if I could open up to Ergon to begin with, and just ask the Ergon team to talk a little bit about sort of what practically employers can do to sort of handle sort of the stigma and stress that's been created for many employees whose working conditions have been made increasingly vulnerable on behalf of over the course of the epidemic, and how best to deal with staff who are facing stress and coming back into the workplace. What suggestions do you have?
Thanks, Guy. I mean, I think that these are both really important points, and I'd sort of take them separately. But I would say in terms of both stigma and stress related to COVID-19, the ideal approach is a preventative one. So thinking about stigma, this is really important because where there is stigma around COVID-19, workers are less likely to seek testing and treatment, and that's obviously an undesirable outcome. So stigma is more likely to arise where there is insufficient knowledge and understanding of the disease. So it's really important to provide clear, accurate and neutral information to the workforce about how the disease is transmitted and treated and how to prevent transmission. It's important to follow up on that messaging regularly and make it easily accessible to everyone in the workplace. Another kind of point is to make sure that there are clear and confidential guidelines for reporting and responding to COVID-19 cases, so that workers feel both safe reporting if they get sick and also secure that they have a job when they're recovered. In this light, companies might want to think about revisiting data protection policies, as we mentioned earlier, and potentially also thinking about anti-discrimination policies and reminding managers and workers about those policies. In terms of mental health, I'm sure we can all agree that, you know, mental health and COVID is, we could do a webinar on that. But I think it's also worth thinking about, you know, what some of the sources of stress are for workers at the moment, because they can be myriad. So for some, it'll be about reduced incomes and uncertainty about job security, which then creates strains on individuals and families. For others, there's a lot of anxiety and stress about contracting the disease, particularly if they're in sort of public-facing roles and have continued to work. I think, you know, the stresses on working parents have also been referred to. So, and then where we're in the context of the return to work, there might be sort of fears about transmission in the workplace as well, sort of leading to anxiety. So, look, in the context of the return to work, you know, it's helpful to think about effective reinduction processes, if you like. So helping workers to feel more connected and engaged when they return to work. Also making sure that they're really well informed about the safety measures that are being taken to keep them safe in the workplace. Keeping lines of communication open. I could go on actually, but I'll pass back to you, Guy.
No, that's fine. I mean, I was actually thinking that I might sort of pick up that theme of reinduction in the workplace actually, and just pass it to Paul for a little bit actually, because I felt that one of the other questions we got in advance before this webinar was about how, keeping with the theme of vulnerability, how do we support vulnerable employees or indeed vulnerable customers who just can't quite follow the sort of the the myriad of OHS advice that's being presented to them at the moment, whether it's from government or whether it's from sort of internal policies and procedures. And just, I was wondering what advice you would give, Paul, for sort of making sure that vulnerable customers benefit from the sort of the OHS guidance that we're producing and every company is producing at the moment.
Yeah, I think it's, as Kirsten said, I think good communication is a key area in terms of making sure that vulnerable people have the right information, they have the right guidance. There was certainly a couple of vulnerable people who were in the team I had when we were working in the oil and gas industry, who were affected, obviously, by the implications of not being able to be in work. And it was a case of making sure that they were kept up to date with information, that they were, that they had access to advice and guidance. So we had information leaflets, and we had communication notices to them with key information, as in people to contact, phone numbers and information. So it was really making sure that they were really kept informed around some of the hazards and some of the areas where they can get further guidance and further help.
Okay, no, that's fair enough. Thank you for that, Paul. And I just wondered on the theme of hazards. We've had a few questions come in from the audience asking about sort of controls or that might be possible, for instance, in relation to air conditioning and sort of the spread of the virus on surfaces and sort of keyboards, door handles, lift handles, that kind of thing. And I know that's picked up a little bit in your guidance, but perhaps for everyone's benefit, you could just expand on that a little bit as well.
Sure. So if we take the likes of ventilation systems or extraction systems, those kind of that type of equipment is subject to statutory inspection, and statutory inspections kind of look at all of the aspects of the system and look at each component to ensure that it's working as it should. So it's important that you know, organisations, workplaces, workplace equipment is still maintained to that level where it does operate as it's been designed to. So the likes of air conditioning systems, there still needs to be maintenance carried out on this type of equipment. Now, the approach to maintenance may be more complicated because of the restriction in movement or accessibility to the equipment because of the areas where it's fitted in the buildings. However, maintenance can be done pretty simply and safely if it is thought through in terms of isolating the areas, making sure only certain people, i.e. maintenance engineers or the likes, get access, making sure the areas are restricted so it can be done safely without people wandering into the areas. So there's a number of points there. First of all, the systems need to be maintained. They are still subject to inspection. There needs to be monitoring and maintenance carried out. So the likes of filters need to be changed in accordance with manufacturer's instructions, and there needs to be documentation maintained. So it's very important for organisations to recognise that this type of equipment is key in maintaining a safe environment, and that the maintenance can be done. It doesn't have to stop. Certain controls, as I've just mentioned, can be put in place pretty effectively and quickly. So that one was the important part for maintenance. And the other point, Guy, was
just on sort of what can be done simply and practically to reduce the risk of transmission on surfaces. So whether that be lifts, but it could be that spans a number of different sectors. So buttons, screens, all of that kind of thing.
Yeah. So again, simple measures can be put in place. Certainly from my experience of this, the likes of the office environment, then sanitizers, wipes can be used to wipe down keyboards or other electronic equipment. Out in the field with equipment that can be the likes of hand sanitizers, PPE, making sure that equipment is checked, it's stored in the right way, so people don't get free access to it when they don't need to. So again, simple low-cost controls can be applied and be very effective, because as I say, in the office environment, we would be surprised if we just sat back and just thought about what we touch in the workplace. And it's not just the equipment that we touch, it's obviously our own behaviors in touching our face or touching other people, which obviously can spread the virus. So again, simple controls, very low cost, and also making sure that it's done on a regular basis.
Understood. Thank you. That's a clear answer. In a second, I'm going to come to sort of this question in the sort of the top left of the which we received in advance, about how due diligence and monitoring, whether it be from an investor or a company, can continue to happen in light of inability to go on the ground. But first, I just thought I'd ask a question of the Ergon team that's come in about where we've got employees, and you can put some control of employees about and raise awareness of employees on transmission and risk factors. But clearly, there's what we don't have control of is sort of the exposure that employees get through their families and through communities. And clearly, now employees are returning to work. There's an occupational health and safety dimension, but there's also a labour dimension if they're trying to maintain a safe workplace. And it could be answered by you, Ergon, or by Paul. What are your thoughts on sort of how we control contamination coming in from the community, or how do we help employees remain aware of the risks that contagion factor has? Difficult, I suspect, is the answer, but I'm interested in any opinions in the chat.
Yeah, I mean, I can take that one briefly if Kirsten wants to pitch in afterwards. But I think, as you alluded to briefly, I think, and Kirsten did as well, I mean, there is the role of providing, accurate health information, and you're at the mercy of your employees as far as uptake is concerned.
Yeah.
I won't cross over to the OSH side, which I'm sure Paul can address, but, on sort of the management systems approach, I think it's sort of understanding, and this is part of the communications piece as well, I suppose, it's understanding the situation of your workforce. How, we're talking about not just, in the communities, but how are they getting to work, for example. So, you're thinking about, are people taking public transit? That obviously is a transmission vector, and that's sort of, that gives rise to risks. So, in terms of the interventions, then you're talking about, for example, employer provided, buses or shuttles operating at 50 or 60% or whatever, that kind of thing. But I think you only get to that point if you understand, our workforce relies on public transit at peak time, et cetera, et cetera. And again, it's also about, I think, the sick leave piece that we mentioned a little bit, because, employers might, employees might be inclined to come to work, even when there's sort of been a possible transmission risk. And I think they will only sort of, it's all well and good to say, don't come into work if you're not feeling well, or if you might have been at risk of exposure, but that needs to be supported where livelihoods rely on an income, right? So that's my brief piece on that. That's
Thank you. Anything from you, Paul, on that?
I think it's certainly from experience. We had a lot of workers who were using vehicles and buses from the camps that they were staying in. So we had big groups of individuals, of workers who had rooms in large camps, who were either using vehicles, vans, minibuses, to come into the place of work, which was causing all sorts of issues for me and for making sure that the work area was kept safe. So we had to really recognise the fact that because of the language difference, we have to try and communicate as best we can around making sure the workers were aware of the potential for bringing the virus into the workplace. So if they didn't fit, so we had to ensure that they understood about the symptoms and making sure that if they did feel ill at any point that it was reported and then we could take action, they didn't come into the workplace. So we had to put quite strict controls in terms of very clear communication lines, very clear information and guidance to them, and also capturing information from the teams themselves in terms of what they've been doing during their time while they're not in work. So we get a gauge as to what is the potential for cross-contamination if they have been into the local area. So it was a real challenging time, and as I say, we ended up having to monitor these people very closely, and again have simple checklists in place to make sure that we don't miss any areas for checks across the people who are coming into the work environment.
Thank you. I think we've got about 15 minutes left, and my intention now is to move the conversation from sort of the risk controls in return to the workplace more to sort of the future of work over the course of the next 6 to 12 months. I think this question that we received in advance, and it could be asked of investors, so I'll have a go of answering it a little bit as well, about how investors can carry out effective due diligence and monitoring, particularly from a labour perspective, with travel restrictions and in light of sort of the risks posed by COVID. I'll open it up to you, Kirsten and Mac, first and foremost, and just ask how can you operate in this environment from a labour perspective, from a due diligence and monitoring perspective? I mean, I've got a few thoughts on that as well, as you might imagine.
Yeah, I can take the first stab at that. I mean, it's certainly something that it's a question that we're asked fairly frequently nowadays from sort of our DFI clients. But this is sort of building into the opportunities and forward-looking piece as well, in terms of actually taking a chance to start now and developing local capacity and expertise. And I think that's possibly a positive outcome from the whole thing. I think one bit of advice maybe that I think is broadly applicable to a lot of sectors and a lot of clients is really sort of deploying the risk-based approach in a different way, or possibly a more strategic way, in the sense that I think certainly a lot of investors already have a pretty decent understanding of contextual risk, whether that's sort of regional, sectoral, or sort of past performance based. So you can sort of say, we don't necessarily need sort of an audit to uncover non-compliances in order to have sort of management systems in place. I think we can already start thinking about what management systems we can put in place, based entirely on our understanding of contextual risk. So I think that's probably not a bad starting point. In terms of sort of some of the mechanics of site supervision and monitoring, I mean, I think the experience is that it's quite challenging, and people are trying different approaches. I know technology is something that's always brought up, and there are apps for work engagement. virtual, there's, site walkthroughs people have been trying to do over sort of live stream or video recordings. I don't know if that's a perfect solution in a lot of ways. There's obviously the tech issues, but also you're at the mercy of whoever's holding the camera. Phone conferences or sort of WhatsApp conversations with worker groups, I think that has advantages. On the virtual monitoring side, if there is a convenient channel of communication for workers that they're comfortable with, I think a lot of these solutions aren't perfect, but I don't think they're a replacement for your normal due diligence and monitoring necessarily. But I think certainly we see that it does sort of reinforce the importance of ENS issues for people on the receiving end, which is maybe its own sort of positive. So.
Yeah, I mean, I don't know if you wanted to add anything to that, Kirsten, but I completely echo a lot of what you were saying there, Mac, actually. And in some ways, sort of the duty of care question about how you get information on the ground that is now as important as the due diligence itself, and both have to be answered side by side, in my opinion. And sort of this concept of getting local insights where you can get that where lockdowns are ending, but also trying to integrate technology into due diligence monitoring is interesting, but there are definitely unproven risks there as well. But of just exactly, that's particularly relevant, I think, from a labour and working condition point of view. You might get a chance to survey more workers, but are you getting the nuances that you would get from face-to-face meetings and the ability to talk on the ground? And so there's sort of, I think, CDC, like all investigators, are finding their own way a little bit there, and where that lands remains a little bit open to interpretation at the moment. Is there anything from you, Kirsten, on sort of just the challenge of remote labour due diligence, or?
Look, I think that Mac did a good job on covering off. I mean, I think, look, there is quite a lot that can still be done remotely, and I think that's perhaps one of the surprising things that we've learned through this outbreak. There's a lot that you can do in terms of management interviews and document review and so on. But yes, it is true that there are some pretty acute limitations as well. So I think it's just a question of being quite aware of those limitations, considering whether there are strategies to circumvent them. But then, as Mac mentioned, also strengthening the emphasis on management systems even more in lieu of actually detecting the risks, if that makes sense. So if you know it's likely that the risks are going to be there, make sure you have the systems to address them, even if you can't sort of pinpoint them.
Indeed. I think, maybe one further question just from this slide I think would be interesting, just to sort of sense check with you, not least because I think it'd be interesting to know what signs to look out for from when you're talking to HR, to sort of give you a feeling of the direction of travel. It's this question on the risk that COVID could precipitate a move towards more flexible forms of employment, to almost like de-risk it from a financial point of view. And I don't know, Ergon, if you've seen any indication that is the case in any of the markets that CDC is operating in, for instance. But what would be the risks of that approach from your perspective?
Yeah, I think I don't know about. I haven't heard of specific experiences of sort of a company saying, okay, our immediate COVID response has been to outsource en masse. I expect it has happened. In other cases with sort of companies we've worked with, what COVID has done is, they've it's sort of accelerated some of these processes towards outsourcing or contracting out. But there were already sort of the seed had already been planted before COVID, I think. But time will tell whether that's the reality. I mean, I think, frankly, yeah, as you said, the flexible arrangements thing is a real possibility as well as a real risk. If we're talking about the investor side, I think the obvious challenge is that, the performance standards don't necessarily give you too much to work with. Obviously, there's no prohibition on these sort of flexible type working arrangements. That leaves you with sort of national law. So I just for one project I worked on, for example, Kenya, I think, is looking at sort of a bill, if I'm not mistaken, that seeks to limit outsourcing through sort of transfer of undertaking protections, that kind of thing. In terms of the risks, that's a legal risk, I suppose. Other labor laws might limit the use of fixed-term contracts, which might be another strategy some companies use. It's also what we mentioned earlier. I mean, if you're sort of converting permanent contracts to another type of contract, like a fixed term, that requires employee consent and agreement often, which can in turn sort of lead to all sorts of problems in terms of worker buy-in and discontent. I think the key there is really you need legal advice to understand, what the nature of any legal restrictions are. And there's broader reputational risks in terms of, I think possibility for resentment among the workforce or the broader community. And some companies might be thinking, this is an opportunity to build workforce trust and commitment through, greater employment security. I think companies that go the other direction might find that, those reputational risks or that customer goodwill might suffer. And I think for maybe more highly skilled businesses, there's obviously the argument about retaining skills and sort of retaining your investment in training and flexible working arrangements not really contributing to that. So
I think that risk of skills drain is very real if you move towards increasing flexibility in terms of forms of employment. We've got a couple of minutes left, and I think that, as ever with a webinar like this, and given the journey people have been on in the past 3-4 months, I think it would be nice to try and leave people with signs, indications of signs of hope in some ways, and just turn with a sense that risk predominates. But I'd be interested, and you did this a little bit in your slide, but if we could come back to this concept of what good is coming out of this from an occupational health or from a labour perspective, just to capture your thought there, to suggest that actually this might be bringing about better ways of doing things as well. And I think that we want to see deployed across all sectors, perhaps, or sector specific. So maybe Paul, you'd like to go first. From an occupational health and safety perspective, what are the opportunities coming out of this circumstance? Paul, you're on mute at the moment. Oh, you're still on mute. There you are. Or maybe.
How's that?
There you are. Perfect.
Right. Sorry about that. Yes, I think increased awareness is certainly something which has come out of increased awareness of disease and bacteria and personal hygiene, the importance of the likes of maintaining your own hygiene standards. I think that's really come out of the last couple of months, which in effect has changed behaviours. So people are now making sure that, well, certainly from my experience, making sure that they do keep this social distancing. Obviously, there will be times when it's difficult to adhere to that, but certainly people are now thinking more about disease, the likes of how it can be transmitted, the likes of increased awareness of their own health. So a lot of positives have come out in terms of positive behaviours, occupational health and safety behaviours, which I think is going to be carried through into the future on how we do things. I think the changes which will be made, which have already been made, I think will stay for a long time. I think people are more aware and are just as productive. working the way they are, working from home, working remotely. Certainly from my experience, there's comfort in the fact that, you know, people have changed the way they do things, working from home.
Yeah,
they're more aware of you know, advanced communications. So yes, there have been benefits coming out of the last couple of months, and we need to carry them through continually going forward.
yeah, totally agree on that point on communication. Maybe Ergon as well. A few thoughts from your side in the last minute.
Okay, on the clock. I mean, I would sound some notes of optimism around you know, positive developments on flexible working. So I
Yeah.
think companies have really been forced to sort of to push forward plans that they might have already had on that, or just to trial it where they might not have. And you know, for many workers, that has brought new work-life balance and flexibility. Of course, it has brought certain strains for working parents during the lockdown, but hopefully as schools and childcare facilities reopen, this group also is likely to benefit from greater access to remote working arrangements. I think there have been some positive developments around thinking through workforce communications, how to do it better, how to do it when workers are dispersed, how to, you know, coordinate, for instance, with contractors in construction. I think there's also been some more thinking about upgrading access to learning as well, whilst workers are working remotely, so providing better access to online training platforms and so on. So, you know, there have been some positive learnings. I mean, I think that it's important to note, though, that some of the net gains are for the more privileged sections of the
Yeah,
workforce.
I agree.
However, but I don't want to end on a downer, Guy. So
No, fair enough. And I think we are pretty much out of time, and so I think it's interesting just from my side hearing you talk, Kirsten, how you can't remove the downside, but you can look at the upside as well. And I think each individual has experienced this themselves very personally. There's been the increased flexibility has been contrasted with different pressures, both in terms of hours, in terms of the expectation placed upon you. And I think that goes across every single sector. And so we're all learning how to respond as we sort of continue this process of building back. I'm not going to ask any more questions. I'm going to bring this to a pause in a second. For those listening, we will share this tape with everyone so that they can share it with others in their organisation. And similarly, we will try and get a Q&A out over the course of the week. I'd like to thank the Ergon and RSK team very much for their contributions and everything they've done getting these notes together at short notice and trying to be as practical as we possibly can be to sort of communicate some quite straightforward messages with as large a number of sectors and different types of companies we possibly can, big and small, local and international. And so to thank you very much everyone for joining, and hopefully we'll be able to do more of these events very soon. Thank you very much.